Most work comp cases don't go wrong at the beginning. They go wrong when providers wait too long. P. Powell here. Welcome to another lesson from the track. Alright, so today's segment I want to talk about workers' comp, when you need to escalate, because most people take too long. Alright, so again, if you've been working, you've had several workers' comp cases. This is never ideal for the company, all right? So most employers, they want to get that person back as soon as possible. But again, our job as providers is to make sure that we take care of the patient. Because again, we know once they're cut loose, they're gonna put them back out there, all right? However, I've seen cases drag out for a very long time unnecessarily. And so it can be difficult depending on if you're in a place where it's like maybe 4 or 5 providers, and then every time they come, they're seeing a different person, and so they're getting different things because people are on different skill and knowledge levels, and so that can be very difficult. But yeah, there's usually gonna be a doctor on board somehow. So I know some places that the doctors will try to schedule it where it's just them seeing them, but of course, you know, there's more of us, there's more APPs, more NPs, NPAs, so we can't avoid that, all right? So just kind of starting from the beginning. So like I mentioned before in the previous video, most of these cases are going to be orthopedic related, all right? So joints, shoulder, knee, hip, back, and all of that stuff there. So over recent years, they have actually been pushing more for PT early. So especially if it's something where, like a shoulder injury, a shoulder is just such a complex joint where we know those can take, even if they have a tear, it's usually a non-surgical thing, but that could be 8 to 12 weeks sometimes. And so we already know for that, it's rest, put them in a sling, anti-inflammatories, muscle relaxers, but PT. And so I worked for a company that's all they did was urgent care, and they got their money from PT, and so a lot of times it was like from the first visit, they wanted you to already schedule it. And it was even in their EMR, like they had it built in, and if you didn't order PT, you had to put like a reason why. So of course, you know, for financial reasons for that company, but also it's better for the patient. So if it's wrist, ankle, not so much. I mean, that's something that'll just take time with immobilization and staying off of it and things like that. But again, if it's back, if it's shoulder, if it's knee, especially if they're a large person with a knee problem, that's gonna take a while to heal. So the push for early PT is something that they're leaning towards now. So I would say, I would say maybe between the second and third visit, depending on the time frame between the visits, but definitely by the third visit. If they're still in significant pain, if it's, you know, about a 6 or a 7, I would definitely do PT if that conversation has not already been initiated, all right? So another thing is referrals. And so this is something that they're gonna need to see a specialist for. So last year I went to a conference and there was a podiatrist there. So we spent a lot of time on foot and ankle injuries, and he spent a lot of time on sprains. So ankle sprains can actually linger for months. He actually said anywhere from like 70 to 90 days. That's 3 months for a simple sprain. And the kind of generalized information is that in most people's minds, a sprain is like 1 to 2 weeks. Okay, yeah, you're good to go. Depending on the severity, that can linger sometimes. So this may be something where they need to be sent off to a specialist depending on the situation. So if you are familiar with the workers' comp process, we know that takes forever. Okay, it has to go to the adjuster and then a referral, and they call the patient and all that stuff. And so it could be weeks. So if it's a pretty significant injury, they're in a lot of pain, and you know that this could potentially linger. I definitely like with shoulders. I usually don't play around with shoulders because those can linger. So even from the first visit, if you examine and they're having weakness, numbness, and tingling, all that stuff, I'll do definitely like a week follow up. I'll just go ahead and put the ortho referral in. Then usually the ortho will order the PT, or I'll just do it from there. And so it doesn't hurt to have it in, because even if you put the referral in and then they go see a specialist, they order. It doesn't matter who does it, as long as the patient gets it, okay? Because again, usually how it goes is that they will want like 6 sessions. And so it's either gonna be 2 times a week or 3 times a week. And so this could be a 2 or 3 week process just for PT in itself. And then also it depends on the patient and their schedule, because if they work Monday through Friday, 9 to 5, that's also the hours for PT. So sometimes their schedule may not be able to fit, and so things, of course, usually take a little bit longer. But again, the goal is to have the case be open the short amount of time as possible. That is in the ideal situation, all right? So definitely start early PT. Same thing with early referrals. The sooner you can do it, the better. Again, it may take a week for them to even get scheduled anyway. So it's not like, something where it's gonna hurt anything. And it's not, you shouldn't take any like offense or like, oh, well, I can take care of this. It has nothing to do with that. Just let the specialist lay eyes on them. Even if they go see them and they say there's nothing to do, great. That's even better for you. It's already been crossed off the list, okay? So the next thing is looking for red flags. Like, is it like by the 3rd visit and they're still in a significant amount of pain, and you're thinking of spraying, and it's like, oh, maybe this could be something a little bit more. And so is it time for an MRI? Or again, if you haven't thought about, if you were just thinking a simple ankle sprain and that has not healed properly, or the pain is not decreasing if it gets to a certain amount and it's still not, is it something that you need to escalate? Now again, with that, you want to make sure that the story and the exam lined up, because I've had patients that with back pain, for instance, or shoulder pain, and every time they come in and it's like the same number, they'll say, oh, it's an 8, and they're like locked onto that number. But with each visit, their range of motion is getting better. Like at first, they couldn't do this, but now, they're, oh yeah, but it's still an 8. And so make sure that you're fully examining each time, and that the story is kind of reflecting what they're actually saying, okay? And then, because I'll even I won't say call them out, but I'll say, okay, but you said last week it was an 8, but you couldn't even do this, and now you can move. So is this still? And so again, you may run into this quite a bit, again, because people in their mind, they just think, oh, I'm on workers' comp, I'm gonna do nothing and get paid, which is very unfortunate, because that's not how it works. And in the really severe cases, like the ones that linger for 6, maybe 8 months, the really bad injuries, like I've had some where I was just filling in the place, and it was like 16 months later. And every time I get those patients where I'm just filling in, and I'll get the story, a lot of times they get fired. Like the company fires them like as soon as the injury happens, or they know the severity, and then they're just on workers' comp. So I think you have about up to 2 years to have like an open workers' comp case. So it's one of those things that is unfortunate, but you will have those patients that will try to milk the system and try to really stretch this thing out. But again, I'm here in Texas, and so it's an at-will state. I've seen a lot of people get fired from workers' comp injuries or something like that. So it's unfortunate. So I like to definitely tell them from that first visit, all right, so I'm gonna put you on those restrictions, let's get you better. But again, the goal is to get you back to where you were. So I focus on function, okay? So is this something where, hey man, like you need to make sure that you're doing stretches and things like that because we want to get you back to work. Like that's the ultimate goal. But again, if you're noticing some red flags, definitely it's time to escalate. It's time to send them out. It's time to get an MRI. With MRIs, that also depends on your company. And again, who else are you working with? Because I'm always in places where I don't want to say the other people don't know what they're doing, but just the stories that I hear from patients and things that should have happened like early on in the case. I mean, they're 4 or 5 weeks in and they were suspecting a tear, but nobody ordered an MRI. And it's like, come on now, this could have been done maybe the second visit or the third visit or something like that. So again, if the company, they don't want to pay for it or whatever, or they're going to give you pushback, I'd rather get some pushback than to just not order it at all. And again, I've had those peer-to-peer interviews where the workers' comp doctor wanted to talk to me and they wanted to basically tell me why something wasn't. I'm not gonna argue, okay, like y'all don't wanna pay for it, okay, this was my suspicion, but whatever, okay? So it can be very complicated and messy sometimes, but the purpose is just to get a lot of this stuff done early on. Get it done early. Start PT early. Get the referrals in. A lot of times nowadays, because of the stories that I hear from patients, how long these things take, I'll do it from the first visit. Get the ortho referral. Put that in. If they need MRI, order the MRI, okay? If you're suspecting a tear, order the MRI, all right? Because, of course, again, most places are gonna have X-ray on site and you're gonna kind of have that done already, all right? So, just some things to do that way these workers' comp cases do not linger, because it's unfortunate that, you know, the companies, they want their employees back. Your higher-ups may be watching how you manage these cases and things like that. So again, you want to be confident in this thing. And so the earlier we get all that stuff done, then again, if it is somebody who may be trying to milk the system, you may be able to, you know, fake an x-ray, but a soft tissue injury, I mean, we get the MRI and it shows nothing or just a bad sprain or whatever, like they usually shut down after that. Because people know about x-rays and MRIs, but if they are playing the game and you have an MRI and it's negative, that usually we're just kind of like, okay, whatever suspicions they had, whatever game they were playing, a lot of times you can shut that down with that, okay? So the sooner the better, all right? And this is best for the outcome of the patient and hopefully their job as well, all right? All right, your MP Pal here, another lesson from the track. Practice boldly, and I will see you on the next one.